really cautioning people. I think it goes on until next week, Tuesday, that expect the sun to be much hotter there and try to use as light clothing and try to get as much shade as possible. But I suspect that heat wave is affecting us as well. It's very very hot, and even for me this morning, I was about to wear long sleeve and tie and all of that, and then I put the shirt on, and then I had to take it off and said, you know what, I am going with polo today because it's really really hot. Trudy, good morning to you.
Good morning to you, Carlton Langdo. I know our listeners of Health Vibes have been saying,
Yes,
where is Mr.
yes, I've missed you,
Carlton
people.
Langdo?
Yes,
Yes.
yes.
Carlton, good morning to you. Good morning, of course, to the listeners of Q95 FM radio and our Health Vibes family. Good morning to you guys this morning. It is a wonderful Wednesday morning. And as usual, we give thanks to God for life and for taking us thus far. I know people are complaining about the heat, but we prefer at least this situation where we don't have storms. We okay. We just have to cope with the heat and do what we have to do, but always giving thanks for life and for the opportunity.
Definitely. I
Mhm.
must tell you, last week I listened to the show and it was very, very well done. I really liked the content. You were talking on PCOS,
PCOS,
and
yes.
that was a very, very good show that you did. I recognize it was a tape. You were live in studio, but you actually
Yes, I played
shared
a pre-recorded
yes, with someone.
show from
Yes.
before.
Yes.
Yes,
So that was really, really well done.
yes.
And I do hope that many of our listeners would have received that information and where applicable. If you suspect you may have those symptoms, to see your healthcare provider so that you can have further testing to confirm whether you do have this medical condition, as it seems, you call it a syndrome, right?
Mm-hmm.
As it seems to be becoming so and so popular, very, very
Mm-hmm.
popular right
Prevalent,
now.
yeah.
But let's suppose that you are heading to Roseau, out of Roseau. Let me say good morning to you. You may be on the farm at this time,
Mm-hmm.
cultivating, making sure that our food security is sustained. Good morning to you. You may really be on that sea this morning. I do hope that you have your large hat, you have your sunglasses,
Hmm.
because we know that being on the sea at this time in that heat is not easy. That's why I've always said that I don't argue with fishermen. If
Hmm.
that is your price of the fish and I can't afford it, I leave it. But I'm not going to argue with you because I know it's not easy catching fish on the outside. And
Mm-hmm.
so you might just be at home listening to us again. Good morning. I want to say to all our men, draw near, near, near.
Yes.
Tune in the volume a little up because we're going to be discussing you this morning.
Uh-huh.
If your wife, you want to listen as well, we're saying to you, put the volume up. And if you know that you have a son and he's of the age of 40 and above, call him now and tell him to listen to Health Vibes,
Mm-hmm.
as we have some very, very relevant information to share with him this morning.
Carlton,
We,
and like I like to
yes,
remind them as well, if you're listening but you want to view the show live, of course, you can tune in to the Facebook page of
yes,
Q95
yes.
FM Radio or the YouTube channel of Q95. I know we have our people who normally view the show, but if you're listening and you really want to, engage and you want to get that view, and we have a guest in studio, you want to get a preview of who that is, you can log on and view the show live.
Awesome. Yes, so this morning we are going to be focusing on prostate cancer.
Mhm.
As we know, the month of September is a month that is set aside in terms of prostate cancer awareness. And it
Yes.
is one of the diseases that is really causing, if we were to say, havoc in the world, more specifically the Caribbean. It is the number one cancer um, that causes death among men in Dominica. And the statistics are still a bit high, though we've seen slight decrease, but it is still a bit high. And we are going to take this opportunity to discuss this particular cancer, what it is, what causes it, what are the risk factors, and what you need to know. Who does this cancer affect? We heard that it is a cancer that is affecting our men. So it is a cancer specifically affecting men and not women. But these men are our brothers, they are our husbands, our boyfriends, our sons, our nephews, and it means that one death impacts not just a family, but a community as well. And so this morning we do have with us a medical doctor by profession, our former chief medical officer, and he is also wearing the hat as a representative of the newly formed men's support group aligned with the Dominica Cancer Society. I am supposed to be part of a group of that group as well. Dr. Johnson and I, we also part of the Dominica Diabetes Association. So we seem to be a liming bad
It
bodies.
seems
We
so.
seem to be liming bodies. But it's good to have you on, Dr. Johnson, as we will be discussing prostate cancer. So what we're going to do, we're going to take a short break. Hmm? Oh, all right. So what
we'll
we will
just
do,
introduce
yes,
the
we'll just
guest.
introduce Dr. Johnson. So Dr. Johnson, welcome to Health Vibes.
Thank you. Thank you very much, Mr. Lando. It's always a pleasure to be here again with you and Miss Trudy Christian. I think last time, it was sometime in February 21st, I can recall, when we did a program. I think it was related to Alzheimer's disease.
Yes, yes. So stranger to the program.
Yeah, I'm the stranger to the program.
Right.
But I mean, it's really a pleasure to be part of this discussion. As Mr. Lando said, this month is Prostate Cancer Awareness Month. It is a time each year that the Dominica Cancer Society, in collaboration with other stakeholders, recognize and observe prostate cancer in Dominica, Prostate Cancer Month, and a number of activities have been planned around that. It's a pleasure to be part of that group, the men's support group. And let me just say, you don't have to have prostate cancer to be part of the Dominica Cancer Society, to the men's support group. I mean, a number of us do not have prostate cancer, but because we see patients with prostate cancer, because we have families, relatives, we have friends with prostate cancer, we saw the need to be part of this support group. Mr. Lando, he said supposed to be. He is a member of the men support group of the Dominica Cancer Society, which have been a great job. So later in the show, we'll speak about some of the things that group is doing, and I really want to commend the sort of teamwork that takes place and the activities that are taking place through a number of different communities around the island as we speak. And we can speak about those activities later in the course of the show.
Thank you, Dr.
Thank
Johnson.
you for having me both. Yeah.
Yes. So what we're going to do, we're going to take a short break. As I said, we're talking prostate cancer this morning. And so we want you to get that volume up and call a male friend of yours, your son, your nephew, your husband, your boyfriend,
Your uncle,
your
your
uncle,
yeah.
your godfather,
Tout
and let
le
them
monde.
know that we're talking prostate cancer on Health Vibes this morning. We're going to be right back as we really get into the discussion.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m., on Saturdays from 8 a.m. to 6 p.m., and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
So we're back with you this morning. As we said, we're focusing on prostate cancer as it is Prostate Cancer Awareness Month. And we said we have someone who is quite, knowledgeable about the disease, who is a medical doctor, who is going to really get into the discussion as it relates to this particular cancer. Let me begin by saying that for me, prostate cancer is quite personal. My grandmother, who is now deceased, she bore 13 children. 13 children. In those days, there, we had many children, and children may have been made for security purposes too. You understand? And so she had 13 children, seven boys, I think, and 6 girls. Yes, I think, yes. And out of the 13, there are 5 that are alive now. But out of the 13, I think about 7 to 6 have succumbed to cancer. And my grandmother herself died of cancer. But about 3 to 4, I think 4 of the sons died of prostate cancer, which are uncles of mine. So it means that my risk is higher now that I know that my risk is higher, and my risk for cancer is quite high as well. And so I'm saying this to say that though I have not been diagnosed with no cancer, but it has sort of encouraged me to get tested. So as soon as I turned 40, although I delayed a bit, I had my first digital rectal examination done at 42 and my first PSA at 42. So that was a 2 years lapse, and that was ignorant of me. And I'm saying this because I too had maybe a few misconceptions or phobias, in the sense that I felt that which doctor am I going to feel most comfortable with, particularly doing the digital rectal examination. And I sat down because I mean, most doctors are sort of colleagues of mine, and I know almost all of them. And until I felt, okay, there is this person that I may not be seeing often. That was my rationale. I'm going to go to this one. And when I did that particular test, I recognized that really and truly there was nothing to be afraid about. And I couldn't believe that the doctor was done. In less than 2 minutes, I was told, okay, we're done. Pull up your underwear and get dressed and so forth. And I became a huge advocate for these particular screening, merely because of my own personal experience, both having uncles died from complications of prostate cancer, and knowing that my risk is much higher, and having done the relevant screening, I recognize it really wasn't anything that would have been as uncomfortable, maybe even as a woman doing a pap smear. And so I'm saying this as introduction to open the floor for Dr. Johnson, who would have done that particular screening to men. And I know just last week he was in Granby doing that screening,
Yeah.
and so he would be able to explain more to the men who have never done it, those who are really afraid of doing it, and why it is so important for you to do it. I've always said too many of us as men are working hard, but we're not working smart. We're working extremely hard. We're building the 3 and 4 bedroom houses and with the beautiful veranda and everything. And we are leaving the wives and girlfriends prematurely, heading to the boneyard. And guess what? Life goes on. And those girlfriends and wives are remarrying. And this man just comes in with his suitcase in that house that you've built and worked so hard for. So let's not work hard, but let us work smarter. I see Trudy smiling. I see Trudy smiling away. Just thinking of somebody just enjoying that house. But Dr. Johnson, good morning.
Yes.
As our former chief medical officer, you dealt with a lot of statistics,
Mhm.
and you would have noticed over the years in that position that our numbers were not really improving.
Yeah.
What can you say about our numbers and why these numbers have not subsided, have not reduced over the years?
Right. That's a good. Thank you again, Mr.
I'm putting
Lang.
you on the spot with that one.
No, that's okay. It's okay. It's thank you very much for that question. But I like the way you introduce the topic. When whenever you speak of a personal experience, it makes it easy. You can speak from it, speak about it without having to go to a book or do any research. And I like what you say. In fact, before I get to the statistics in terms of helping to this, what you did just now was to help to demystify, I would say, and the fear and the phobia men have with regards to doing a digital rectal exam. And yeah, so it's a very simple exam, a digital rectal exam. I mean, yes, because of our society, men some do not want to get examined through their back passage through their rectum, but the exam itself takes less than a minute. When I'm doing, I mean, I've done hundreds, probably thousands by from the time I'm in private practice now, digital rectal exam, and men ask the same question that you are. They're surprised that it's over and over so fast.
Mhm.
I mean, with a glove finger, with your glove and gel on your index finger, the man takes off his underwear, takes off his pants underwear, normally lies on his left side, and you get to the back passage. Because the only way you can actually, through a
Access.
medical examination, ex- examine the prostate, which is, and we'll talk about more about the prostate in a while. It's where, because of the anatomical position. Weight is in the body. Forget about this big word, anatomical weight is in the body. It is in fact just below the bladder and in front of the rectum. So the only way to access it and to access it easily for a physical exam is through the back passage. And yes, it takes more time for you to take off your clothes and put on your clothes for a normal doctor, a doctor who has been doing it for some time to actually examine the prostate. With your gloves on your hand, gel on your finger, and look at the size of most person's finger. And you access the prostate, you can tell a lot of things. You can tell, okay, well, if it's enlarged, for one, you can tell, how it's supposed to feel. It has a certain sort of consistency, what we call consistency, texture. You can tell whether it's too hard, or something is wrong, whether it's painful, whether there's a lump there. Okay. So there are a lot of things you can tell with doing the physical exam. And for most doctors, it will last. The actual exam is going to last for less than a minute. 30 seconds, 45 seconds, and actually doing a physical exam. So one who doing practice. So let's get back to your actual question now. But I just felt I should say that.
Yes.
And I, you seem to, we share a lot of things together, I guess that's because of your background, Mr. Lando and Judy,
Yes.
in you as a health educator and health promotion person. Because every time I give a talk to prostate cancer, and I just did one with Mr. Patrick in Granby, which we'll talk about later, last week Wednesday at the credit union, the garage of the credit union, Granby Credit Union. They call it the garage, but I call it the conference room. Every time I speak about prostate cancer and doing the digital rectal exam, I compare it to a lady getting a pap smear done. I mean, for a lady to get a pap smear done, I tell them, look at the big piece of iron. Well, I'm not saying that to scare you. It's about getting a pap smear.
Interestingly, I had one this morning before I came to the show, and you're correct. I think it's a more difficult process
it is,
than what you're describing for the DRE.
Yeah, because I'm using, I say a doctor is using his hands, okay, but you're using a speculum,
For the pap smear,
a piece of iron.
An uncomfortable speculum.
And ladies are not afraid to get it done, but men are afraid to get it done. So yes, that is how it is done in terms of the physical examination. I meant to speak about data and you asked the question, so we'll speak about it now. Yeah, prostate cancer is a concern not only in Dominique, it's a concern globally. In fact, I had some data which when I prepared for the show and even last week, one thing there is what they call the Global Observatory, Cancer Observatory, Global Scan, CAN, that it put out some data and it actually shows that, that this is the fourth commonly diagnosed cancer in the world globally, prostate cancer. And in fact, it's the 8th leading cause of death from cancer-related death. But for men, the other statistics that show for men, it is globally, it is second leading cause of death by cancer. In terms of Dominica and the minister, if you have listened to the minister earlier this month, I think when he gave the address with regards to former Lunging month, he gave some brilliant statistics. The thing is, over the last decade is what, 10 years, we have noticed that prostate cancer has consistently ranked among the number 10, around the 10 leading cause of death in Dominica. Okay, so it's high. And for 2023, that is last year, it was the 6th leading cause of death. So when you take all things that kill in Dominica and you put it together and you do the analysis,
it's number 6.
Yes, it's number 6. Okay?
That's high.
It's high. It's high. It's high. That is, but that is what for everyone that's killing men, everybody in Dominica is the 6th leading cause of death. The number in terms of death from prostate cancer, it sort of dropped a little encouragingly from 2022 to 2023. 32 cases in 2022 and dropped to 26, and we hope, I'd love to see that number goes down, that it continue to go down. And that could be, well, we can't conclude too much just from 1 year's data. Okay, we'll have to look at the trend and see whether that trend continues. Okay, but what are the things that have been happening? There's an uptick in terms of screening, and we must commend the Dominica Cancer Society and particularly the men support group. But at the same time, just too many of our men, Mr. Lando, Ms. Trudy, and our listening public out there, or men out there, too many of our men are dying from prostate cancer. Too many of our men, they diagnose of prostate cancer at a stage when it is too late, when a lot cannot be done in terms of survival. And it pains me as a physician, a practicing physician, to see man in his 60s diagnosed late of prostate cancer, and then it has already spread to his backbone. We talk about the signs and symptoms to his backbone. It affects nerves, and men can't walk, and then he is there getting he's bedridden and getting bed sores. Whereas if you had what you call early detection, and we speak about what is early detection, then you could detect the cancer very early, and offer the person, the man, what are the treatment options, which we'll speak about later in the program. So yes, the data is frightening. We think the numbers could be much less. We love to see the numbers much less, and I think with the great work that the Dominica Cancer Society is doing, and the main support group in helping to demystify it, and persons like you, Jolly's Pharmacies, and other persons, speaking about it. And what I like very much is when persons share their experience. Because yes, doctors will talk a lot about, what is the medical aspect, but when you speak about your experience as a survivor, people can relate to that. People can understand that. You're not a doctor speaking, oh, yeah, Mr. Breve, he had prostate cancer. I think prostate cancer, he had looking mash up. Some people are prostate cancer survivors of prostate cancer, and they're walking on the road looking very good.
True.
Very good. Either haven't told anybody that they had prostate cancer and got treatment, they wouldn't know. And that's one of the things we're trying to promote for the men support group of the Dominica Cancer Society, helping to demystify it. And maybe I should just add a little thing there. One of the things I love about this group, Mr. Lander, Ms. Christian, to the listening public, is the composition of persons that are on it. I mean, we have on it, we have persons who are former PS, persons who are managers. We have survivors. I mean, we have survivors in it. We have urologists. We have public health specialists. We have a priest. We have pastors in it. We have psychologists. We have pharmacists on board. And we have somebody like yourself. I say a pharmacist slash health educator, health promotion specialist, because these are the critical persons that are there. And the person to help to provide, counseling, psychosocial support, a venue, a platform where men could speak, about their experience, and to help to support our other brothers. Because the truth is, for any cancer, having any cancer is a very painful thing. We know that, very challenging. I can talk about the cause, but more so, men, some society is a taboo, and men don't like to talk about their private parts. And to have a man, a survivor, speak about his experience, like you boldly spoke a while ago. I love that someone. That's why I'm coming back to the fact that you opened the show by speaking about your experience on how a digital exam. It made my task a little easier, because then when you do this, some men before do the digital rectal exam, that is, let me explain that simple. Digital rectal exam, examine a man for his prostate through his back passage, through his rectum. That's what digital rectal exam means. Some men will ask, Doc, would I be able to walk after? Because
Yes,
they don't know.
they don't know.
When you finish, like we were having this exam, the screening going on at the Grand Bay Health Center on Sunday, and men were so happy about having it. When you finish, you say, oh, Doc, you done already? Well, it wasn't myself alone. We had other doctors there. We had a urologist there from Grand Bay, Dr. Jacob, who did a great job. Thanks, Doctor, and the other doctors on the Grand Bay Health team. He said, you done already? Oh, I can go and tell my wife now that I did the exam. I mean, some of them use other phrases. What's the local phrase they would say? I had the finger down. But so we can continue to talk about prostate cancer. I mean, what the prostate is, what it is, and I would love for us to speak about the signs and symptoms of prostate cancer and treatment, and how it is diagnosed. There's a lot to talk about prostate cancer, but I'll pause here for now and entertain your questions from the public.
But Dr. Johnson, I definitely wanted to put it in perspective. We started talking about cancer of the prostate, but what does the prostate do for, what is it? What does it do? Why is it important? I think that aspect of it, a lot of people don't even, know why is a man's prostate gland important? What does it do?
But that's a very that's a very good question. The prostate, as we said, is this small organ, that lies, below
You said below the bladder,
and in front
front
of the
of the
rectum.
rectum.
And when you pass in urine, there is this urethra that passes through it. When this tube that comes from the bladder,
Yeah, urethra.
passes through the prostate, and also you have the seminal vessels, the whole production, sperms, and that thing passes through it as well. So the prostate is actually part of the male reproductive system.
Mm-hmm.
It is part of the male reproductive system, which entails the penis, the testes, etc. Okay, and part of part of what it does, it is actually involved in the production of fluid, semen, in production of fluid, of semen. So it is actually very important, for men. And men consider the prostate a vital piece of organ. In terms of size, it is small. It weighs around 25 grams. 25 grams. You have to look at the actual volume. It's around 25
Like a
cc.
walnut.
So, yeah, like a walnut. You're right. That's what like a walnut. And the strange thing about the prostate is, unlike other organs in your body, as you get older, the prostate gets larger.
Mm-hmm.
So it normally goes through what I call growth spurt. At puberty, it grows. It gets larger. And somewhere between 25 to 30 years, it begins to grow again and continue to grow. The other organ don't seem to get so big, but that prostate seems to be getting bigger as you get older. And as you get bigger, as you get older, then it can cause other trouble in terms of what we call benign prostatic hypertrophy. In other words, it's enlarged and it's causing a lot of problems. Okay, because as I said, because of where it is located,
BPH.
and we can it's called BPH. Okay, and I want us to speak a little bit about BPH and how we distinguish it from actually
Prostate cancer.
because the signs and symptoms could be similar.
Because most of our people will just say, our prostate.
Yes.
That's
yes.
how they will normally see.
Mhm.
But we know better that they mean that either they have the enlargement
Yeah.
or they have cancer.
Right.
Because all male have the
Yeah.
prostate unless it's removed
Except-
surgically.
Right.
But you're going to differentiate between the two.
BPH.
Yes.
Yes. Okay. Good.
And two, are they in terms similar, and are they both serious medical conditions?
Yeah, that's a good question. Actually, the science and what men would present with, sorry, I'll tell you again, what men presented for BPH and prostate cancer could be similar. The symptoms could be similar, but it's two different disease or condition. One is benign, okay, one is cancer, one is not cancer. So as we explained earlier, your prostate gets bigger as you get older. Start to grow, you go through this spurt at puberty, 20 to 25 years, it begins to grow again, and this gets bigger. And as it gets bigger, it presses on the bladder, okay? And also it can affect your back passage as well, because remember we said it's in front of the rectum, so it can affect how you pass through. So a lot of times what you might find when you have BPH, okay, it's you would have trying to get up a lot of nights to pee. You get up a lot of nights to pee. I mean, generally, people drink a lot of water at night. Some men don't get up in the night to pee. You get up 2-3 times. We call that nocturia. But in other words, you get up a lot of times, particularly at nights to pee. Okay, because your bladder cannot retain all that water, all that urine. I'm sorry, urine that it used to retain. Another thing is, so that is one. Another thing you will find that you go to the bathroom and you have to force to pee. You see forcing to pee, you manual or urinal, and they have to hold their waist or squeeze under the belly, because you have to force to pee. You're trying, or you find that before you used to pee and you had a heavy stream, You know,
Mm.
from where I'm from, Marigot and some other places in the country, people say when you people you could dig a hole, you could
Mm.
plant a fig tree in that. But as you get older, you find that this thing is like like a little
Drip.
stream, a little stream. And
Mm.
sometimes, you know, when you're urinating because of the pH, because of all that compression that it has, you know, your people stop, cut on you. You don't finish prepare, and you feel this sensation under your abdomen that you're not finished urinating. Okay, you feel that you stop, but you feel that you know you have to pass something else. So you're okay. The other thing is you could have pain when you're urinating. Okay, you could have pain when you're urinating. Some persons with BPH as well could even have um, painfully ejaculation or painful ejaculation. And you could also have, even rare cases, you could also have difficulty to the prostate gets too large and compresses too much on the back passage. So those are some of the signs of BPH, and they're very similar to prostate cancer. Okay.
Would BPH also include blood in the urine?
Not generally, but you can. You
blood
can,
in
but
the-
you normally find like blood in the urine, right? What you call hematuria with prostate cancer,
Prostate
because
cancer.
that time it means that it actually begins to invade the 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 bladder, okay, or even the kidney. All right, you get that's what you call hematuria, you know. And also another sign, well, an additional sign most times, or you can find with prostate cancer, it's pain in the back, or pain in the hip. When you have pain in the hip, you wouldn't usually find with BPH. Pain in the back, your lower back, you know. A lot of our men like to say it's gas. You know, I have gas in my back. Or it's because I was working hard, you know, I working so hard. I was lifting, I'm a mechanic, I'm this, I'm that, you know, I'm a farmer, you know, or I sit down too long, you know, my back hurting me. I mean, it could be because of that, but you need to check.
That's true.
It could be because of that. And also pain in your hip as well. Okay, so that is why it's very important, absolutely important to get screened. But very importantly, someone could have prostate cancer and don't have any signs or symptoms. You know, there are men with prostate cancer and don't have any signs and symptoms. So I'm saying this to say that even if you're not presenting with any signs or symptoms that we spoke about just now, and you're a man, and we are advocating for men above the age of 40 years to get screened, and more so if you're at high risk for prostate cancer. And for risk for prostate cancer, basically, one of the major risks is age.
Okay.
Because it's age. All right. As you get older, there's a higher risk that you might get a cancer. The longer you live. I mean, that's a share statistics, you know. Or the probability, chances are greater as you get older to die young. Okay. And also one of the risks, and Mr. Lando, you spoke about it as well. I mean, you almost had all the whole program. You spoke about family history.
Family history, yes.
Family history. A lot of times, well, every time you go to a doctor, doctors should get a family, take a family history from you. Okay. Has any of your blood relatives, you know, suffer from prostate cancer, from any other cancer? So father, brother, uncle, you know, have they suffer from any prostate cancer or any cancer? Because if you have a high cancer is running in your family, as we say in Dominica, then you'd want to even get screened earlier. So those are the two main risk factors for prostate cancer.
Family
The other
history and
things,
age.
yes, the other things that are associated. I mean, the other things which the science have been looking at, and there's some studies that have been put out in terms of, you know, the consumption of, you know, especially animal fats and those things, you know. It's associated with prostate cancer.
Dairies, red
Yeah,
meats,
right. Well,
Mhm.
animal
processed foods.
animal
Mhm.
product,
Mhm.
processed food in general associated
Yes,
with,
yes.
with cancers.
Mhm.
So some studies have shown more evidence than others in terms of those what you just discussed, the other risk factors, but these are the
The main
the
ones.
main ones.
But
The-
we've also known to, without cutting it,
Mhm.
that one of the ways that we can see that our prostate is making changes is again by the stream.
Mhm.
So if you line up a 7-year-old boy, a 40, let's say a 50-year-old man,
Mhm.
and a 79-year-old man, all three of them, and you ask them to pee, you'll recognize that none of us could, or P could not, as pitch,
As
couldn't
far.
as far as the 7-year-old boy P. So they say that as you get older, your P will get closer to your feet. So oftentimes you'll find in elderly men, the wives and so forth, oh, they have to be cleaning the bathroom all the time because they'll more likely oftentimes pee outside of the toilet or on the
Yeah.
toilet bowl. So that is one of the things that they say. Science is now indicating that we can see how the prostate is changing as we age.
Yeah.
So
Also, I see we have someone trying
So
to.
that we also have what dribbling as well.
That too.
That's called
we have a
dribbling.
caller.
Yes.
Good morning to you, caller. How are you doing today?
I'm good. I'm good.
Very good.
Yeah. Dr.
Dr.
Johnson.
Johnson, yes.
Okay, cool. Good morning to you.
Mhm.
Yeah,
Morning,
I'm
sir.
listening to the program there, and I'm hearing all these different things, and we're talking about. We know that it is said that the prostate has two stages of growth: when you're in puberty, and then when you get somewhere older.
Mhm.
Now, you said when you get older now into the like 40s, 50s, it starts to grow. Now, with that growth, is that a hormonal problem? Question to the doctor.
Yes, that's a nice question.
Huh?
That's it.
No, interactive. I'm interactive because what I'm saying is a lot of things that's going on within the body. I'm always of the opinion is hormones and bacteria that run our system. Now you have situations where people eat badly, and I say badly because what the amount of nutrients that the body needs for it to function properly, no one person really eats all the food groupings that all the nutrients that the body needs. So, in my opinion, when you have in Dominica and maybe other places, the food that people indulge in is all the starches, the sugars, and even the what you call it, the caffeine. Now, I'm thinking that all that has an effect on the prostate and the body on a whole. Now, there's a lack of exercise. All the pelvic floor, all the muscles within the pelvic floor that are not used, the endothelial problems with handling of stuff in our body, all these things. So all that has to go back to diet. So whether one, in my opinion, might have a family or family might have a history, I think with proper diet, a lot of things can be turned around because once you turn around stuff with diet, then you're balancing hormones because pituitary gland, hypothalamus gland, all these things involved in proper diet from your digestive tract, from your mouth to your stomach, so you have good gut bacteria from your good oral bacteria, good gut bacteria, so then your brain gets fed properly and everything is in harmony. So I want to take it from that perspective because I want to think that there is a hormonal problem within men that causes that prostate to be enlarged. And it's just my opinion because I'm a man that was going through certain things and doing certain things within the diet, even and stuff that I put in my system. A lot of people would not even want to do that. And it is just stuff that just grows. And we have the liver, the kidneys, all the different organs. We like sweet, we like salty, but we don't like bitter and sour. Bitter and sour are our medicine. About the let's just want to introduce that, and I'll listen all in.
Thank you very much. Thank you, caller. So he's attributing, or he's asking, or he's of the belief that it's a hormonal issue.
Yes, there are a lot of studies which shows yes that I think everything that causes or the real cause of why the prostate gets bigger. I mean, there's still a lot of investigation, but the main reason that has shown is the hormonal imbalance in terms of the imbalance between what they call testosterone and dihydrotestosterone hormones. Yeah, as you get older. Okay, testosterone level drops and dihydrotestosterone levels seem to get high, and that creates has an effect on the prostate and causes it to grow. So he's in part right in terms of the hormonal issues, right? The diet is I don't know if any specific diet that makes the prostate would grow in size, but that has an effect on the prostate, on your general health, and particularly some diets in terms of cancer and management of cancer, because the more fruits and vegetables that you eat, especially fruits and vegetables that are high in what you call antioxidants, this is protective against cancers. And there are a lot of studies that show there's a lot of what you call substance in tomato, things like tomato, pumpkin seed, pawpaw seed, and even what you call, I don't have it in Dominica, but you purchase it, salt pulp and minto, which is good for prostate health. Okay, so in short, yes, the idea of a hormonal imbalance because of the imbalance between testosterone, which is a male hormone, and dihydrotestosterone is one of the things that are attributed to the increase in size of the prostate. Okay.
I see we have another caller. Good morning to you, caller. Thanks for calling. Please
lost
do
that
call
call.
back. The number is at 449-3095. Good morning to you, caller.
Yeah, good morning.
Good morning to you,
Health
sir.
Vibe.
Good morning.
Yeah, it seems to me that when a program like that starts, it should be almost like a declaration that if you don't eat healthy, expect problems. It should be the first thing that is talked about. And then for those of you who don't eat properly, make sure you get tested. It seems to me that's how it should start. You shouldn't be discussing that at the end of the program. That diet. No, diet must be the first thing. It must be the first thing that you present to people and tell them, well, if you're not on that healthy diet, expect all kinds of problems, not even just prostate. So that's how I see it, gentlemen and ladies. Thank you.
Thank you, caller. But yes, Judy. go.
No, you can go ahead, Carlton.
I was just saying that I like I realistically what you're saying makes sense, but the fact of the matter is that sometimes you do all of that, you really have a real good balanced diet, you do, but remember too that genetics also play a factor in cancer. So it's not just merely a lifestyle, but genetics can also play a major factor as well, and hormonal issues too also plays, and that may not necessarily be linked to foods. So yes, you what you're saying may make some sense, but it may not be um, the chief fundamental of preventing cancer, because some way somehow we all have to go, and something must take us out. You understand?
One of our Facebook listeners or viewers, sorry, is asking a question, and that is something I've been wanting to bring up, Dr. Johnson. As we speak of prostate cancer and we speak of protective factors, we spoke of risk factors, then we went into protective factors, we spoke of diet and so on. I remember doing a review in a case control study when I was doing my MPH, talking about something in terms of how people remember their past. But it was a study on prostate cancer, and men were asked to recall their sexual history, because the study was trying to see the correlation between sexual practices or frequency of sexual intercourse and prostate cancer. The listener is asking that we've heard about the frequency of sexual intercourse affecting the occurrence of prostate cancer. Is there any medical study to support or debunk this? And it's interesting because I remember reading that study where they were trying to see if there was a correlation between the sexual frequency and prostate cancer.
Yeah, so that's interesting.
Mm-hmm.
It's interesting discussion. Yes, I didn't mention it, but There's some studies that have shown that,
Mhm.
the frequency of ejaculations, frequency of sexual intercourse. At least from when they studied a number of men, they realized that men who have a lot of sexual intercourse or more, tend to have less prostate cancer.
Mhm.
So yes, there are studies which relate to that, and some of what is believed that it helps to, probably frequency of having helps to flush out some of
Clear
those
the
cancer. The
okay.
cancer, and yeah. So there are studies which definitely have shown that in large groups of men that have been studied. Yes.
Yeah, the interesting thing is when I was speaking about it, I was teaching a class yesterday actually, and it was about what are some of the forms of bias that can enter studies, like that. So one of them is, you ask men to recall what was their sexual history like. Some people will exaggerate what it was. You know what I mean? So you have what we call recall bias. Yes. Because some men will say, every 5 times a day, that's what I used to have, and that's maybe not true. But it's an interesting concept. So the protective possibility of frequent sexual intercourse for the prostate. Okay.
Yeah, so there are studies which have shown that in
Okay.
terms of frequent intercourse. And in fact, I mean, probably in certain cultures, and probably not in our culture, persons also. So there are studies which look at terms of even persons who are not having sexual intercourse, but even masturbation. So that yeah. Okay. I mean, probably for some of us and for some cultures, religious group, it's not something that would promote it. But there are studies. I mean, as a physician, as one who looks at the science as well, I mean, we have to admit and we have to declare what are the studies that are out there. Okay, so nothing is not conclusive, but there are things that have been looked at and studies that have shown that. I mean, so some person might do this study and they have found that, other studies may have done it and not have seen that, but there are studies which show that. Okay.
Dr. Johnson, I know we have to switch gears shortly
Sure.
to connect with a survivor, but I wanted to ask you because it is one that seemed to be a bit misunderstood, and that is you have quite a number of men who would maybe see their doctor, whether it's and would just maybe request the PSA and not do the digital rectal examination. Should the two be done simultaneously, and can one be done and not the other?
That's a very interesting question. We advocate because to do physical exam and to do the PSA. The PSA, there are a number of things that can affect your PSA, okay, which could not be or not necessarily, or is not necessarily, I would
Prostate
say,
cancer.
prostate cancer. So let me repeat that, okay? As I indicated earlier in our discussion, I mean, by doing a digital rectal exam, one can tell a number of things, okay? I mean, it's not conclusive for diagnosing prostate cancer, digital rectal exam or physical exam, okay? Can speak about the consistency, okay, of firm or soft it is, whether it's painful, whether there's a mass, whether it's wrong, whether it's smooth, okay, and whether it's enlarged. The PSA by itself is not something that can tell you directly whether you have prostate cancer, because a number of things can affect your prostate, your PSA, including whether you have BPH, that is benign prostatic hypertrophy. Other things that can affect it in terms of if you have prostatitis. Prostatitis, let's put it that way, inflammation of the prostate, and infection on the prostate. It can affect it, and that is not prostate cancer. In fact, there's the evidence that show, for instance, that if you have, let's say, a surgery close to your prostate, and it can you can have an elevated PSA as well. In fact, there are studies which have showed that and if you are doing a lot of biking, riding bicycle, there's some trauma that is placed on, you know, trauma, the prostate go through some trauma by just riding bicycle. And if you go to do a PSA soon after doing biking, and your prostate, your PSA would be increased,
Elevated.
would be elevated.
Yeah.
And
So
even
the prostate-
even having sex before.
Exactly,
Yes.
exactly.
Yes.
Yeah. Oh wow. Ejaculation
Yes,
is one of
people-
the
yeah.
Could elevate the PSA.
Yeah.
Elevate the PSA.
But
So-
for the listeners, Dr. Johnson, we started with the PSA story, prostate specific antigen, the blood test,
Yeah.
Yes.
just to
Mhm.
classify, because people might ask, what is
yes.
PSA? You know, so the blood test
Mhm.
that
Right.
some people may feel they could do in place of the physical exam. That's what we trying to give some information on there, Dr. Johnson.
Yes.
But it's interesting how many things can impact
Yes, a lot.
that test.
Well, yeah, a number of things can impact,
Mhm.
impact the test, you know. And then again, there's a lot of discussion on this. Not, let's say, a cutoff.
Mhm.
Well, it depends the type of PSA you do. There is what you call. We don't want to get too technical on the show
Mhm.
because we want to communicate with our listeners out there. I mean, there's free PSA, those total PSA that's combined. You know, a lot of things that you want us to look for when you do a PSA. What type of PSA that the doctor is requesting, but there's still a lot of discussion as to which value. There's no specific value for PSA that you can say that person has
Prostate cancer.
As a matter of fact, it's a combination of things, and I hope we can get through. And you need to get to the survivor.
Yes.
But prostate cancer, the diagnosing prostate cancer is a process, you know.
Mhm.
You do physical examination, you do the PSA, and based on the results, one could go to the next step, doing an ultrasound of the prostate, and most importantly, if you suspect prostate cancer, then do a biopsy of the prostate. And there are different ways in which one can do the biopsy of the prostate, because all cancers, okay, all cancers, a doctor can say clinically based on the presentation that you have, whether it's in your stomach, whether it's in your throat, whatever part of your body that is cancer. But who gives a real stamp to a cancer and say it is cancer and what type of cancer is a pathologist. In other words, when you send part of it and send it to the lab to test, they say, yes, that is cancer, through what we call a biopsy. A biopsy is taking a little part of the, whatever it is, the tissue, and send it to the lab to test. So the point I'm making, or we are trying to make, is that one should not only do the PSA alone. Okay, some men would say, okay, look, I just want to do the PSA alone. Okay, if it comes back high, I can't say, or doctor cannot say why it's actually high, because I have not, or he has not done
For investigation.
not only the investigation, the physical exam, the general exam, to say, wow, I think it is related to, I suspect it might be related to prostate cancer or BPH, because you don't know, okay? Because in medicine, to get to a diagnosis, I mean, there are a couple of things that has to take place. I mean, that's what you learn in medical, any part of the world, whether it's in Europe, whether it's in China, whether anywhere, there's a process. You take a history, you call it the history, you listen to what the patient say. And I always say this to you, a lot of the times one can come to a diagnosis by listening to what patients say. You know, if I can medical school, we want to be too quick to put stethoscope and go and examine patient. And some of doctors used to take our stethoscope and throw it, because you have to listen a lot to what the patient say. Take the history, then you do the physical exam, and then you do what you call investigations, and there are different types of investigation. The PSA is just one type of investigation. So history, physical exam, okay, and doing investigations, whether it's lab work, whether it's X-rays, image, and the whole sets of investigation.
I see a listener asking about MRI before biopsy, so that there's a lot that you can even go into as it relates to getting that diagnosis.
So yes, I recommend that. I'm a personal knowledgeable, and there's a lot one could go and look at. I'm full reliable. I'm sites there. Yes, in fact, the use of MRI and doing biopsy, okay, it's very, very important. So generally, you could do what you call a transurethral, transrectal. I'm sorry, transrectal, not urethral. I repeat, transrectal. I was thinking of another procedure, but transrectal ultrasound. That is the ultrasound probe through your back passage, just as how the doctor put in his finger. Okay. But there also a combination of doing an MRI of the prostate and doing that ultrasound so you can get to the exact point where you suspect to do the biopsy, okay, where the prostate is. So the MRI imagery that you had previously and with the ultrasound, okay, you can get to the exact point, okay, of the prostate and do a biopsy of that prostate. So the combination of the yes.
Yeah, okay.
MRI.
All right.
Do we have our survivor on the line?
Yes,
Okay.
we do. Good morning to you, Mr. Henderson.
Yes, sir.
How are you doing today?
I'm fine, and you?
All right. I'm happy that you've joined us for this discussion as we're focusing on prostate care, prostate cancer, prostate awareness month. Just tell our listeners you are a survivor of prostate cancer. Maybe beginning with what prompted you to visit your doctor? How did you deal with the diagnosis? And what did you change? What did you do to ensure that you become a survivor?
Okay, let's start with what prompted me to visit my doctor. Actually, my doctor is Dr. Paul, and I had been doing regular annual physicals with him from way back in my 30s, 40s. When one year, I think it was 2009. Yeah, oh no, prior to 2009, when my brother Lambert Henderson, Mikael's father, died of colon cancer, and Dr. Paul found out that he was my brother, so he was my brother. He started questioning me about the history of cancer in the family. And this is something I'd never given any thought to. But when you were young, you don't think of cancer. You live your life, you enjoy life. Cancer is the last thing on your mind. But then when I began reflecting on family history, I realized that I had an aunt who died of breast cancer. I had
You have a little feedback. I'm not too sure if it's wind or.
Oh, yes.
That's better.
Yeah.
Yeah, maybe you're fan.
Sorry. Yeah.
Okay, that's better.
So, yes. So I had a sister who died of breast cancer. So I began thinking about it a little more seriously. And then I realized also that I had two brothers who also died of prostate cancer. So I had to take it a little more seriously. I told him so, and he said, okay, then we have to do regular PSA and DREs every time you come in to do your annual physical. So we did that. And in 2009, when I did it in early 2009, we did the PSA. It was 4.5 or thereabout. And I've been monitoring it. I've seen it increasing gradually. And he did the physical exam, and he told me I can feel something greeny on the prostate. So that's a sign that something is happening. So you need to do a biopsy. So I was supposed to do it at Medicus, but then they were closed. So since I was traveling to St. Lucia, a friend of mine told me about this urologist in St. Lucia where I could do it. So I did the biopsy there. And of the 8 samples they took, I think 6 of them came back with cancer, that they were cancerous. So I had to decide, okay, I kind of, in a sense, was expecting it. I prepared myself for the worst, so to speak. But it still shocks you when you hear it's cancer.
And did you at that time prior, did you have any symptoms at all?
Not that I can recall.
Wow.
So, but just that we were monitoring them, correct?
Yes.
So the changes gradually. So
we had to decide, well, what do I want to do? They gave me several options. Um, but then I thought about it further and said, during that period of time, I had three other brothers who developed prostate cancer and had their prostates removed.
Wow.
So that's a total of 5 plus me.
Hmm.
So it means that it is in the family.
Hmm.
So given the choices that were proposed to me, I decided to do a radical instead of treating it or doing any of those things. So I just removed it completely.
Mm-hmm.
And I changed my diet. Since then, I've changed my diet. I have become more, I've read more about it, and I've become more conscious of the things I need to do to stay healthy. I moved away from dairy products. I don't use sugar. I use a little honey, but that's about it. And I eat a lot of fruits and vegetables whenever I can get them. I moved away from a lot of processed foods too, and the processed drinks, like chemical drinks and so on. Just trying to refocus into a more healthy diet.
Makes a lot
And
of sense.
exercise. I think the basketball, so that's good exercise.
Can I
And
ask?
also a positive mental attitude.
Awesome. Can I ask you at what age
Oh,
were
yeah,
you
I was-
diagnosed?
I was about to
At 60.
At 60.
60.
And
Yeah.
prior to your first time when Dr. Paul
Actually,
spoke to
59.
you, you had passed 40 already and you hadn't done no screening?
No, I had been doing from 46.
Oh,
I've been
46.
doing regular PSA and digital rectal exam
Oh, from 46.
every year, consistently every year.
So you were 6 years behind.
If you want to look at it, 40 years.
Okay. I mean, there are many men too that would have heard about, oh, if you remove your prostate, it affects your sex life, and a lot of men prefer to sacrifice keeping the prostate, though it may have cancer, and rather than having it removed and sacrificing their potency.
Right.
What do you say about that?
Okay. Well, I have known guys who have died because they decided to stay with the prostate just for sex purposes.
Ah,
But the technology is it's so much better now that when they do the surgery, the thing that affects your sex erection is the damaging of the nerves.
mhm.
But the technology is such that they can avoid it now, and you can still have sex even if you have had your prostate removed. You can't have children because
Yes.
the prostate is no longer there, but you could have sex. Yeah.
Yes. And can you still, because there may be men listening, can you still experience an orgasm?
Yes, it's just that you don't get any semen.
Ah, right. So again, you're hearing it from a survivor. Now, as a survivor, though, I'm asking you that question because we've been trying our best to really get the younger men, particularly within the age group of 40 to 50, to really get screened. How do we narrow that gap, and how do we encourage them to get screened early rather than waiting maybe 50 something, 60, to have that done? How do we get that information? And many of the beliefs and ideologies and misinformation that they may have, that has some way somehow prejudiced the relevant test that is done for the prostate. How can we get them to be more sensitized that it is important to have your prostate screened?
Well, I think several things. One is now that we are more active in promoting or advocating for prostate care and getting checked, I think it will encourage more men, and we have seen it to encourage more men to come out and to check early, number one. Number two, I think many of our men are scared of the digital rectal exam. So the PSA is easier. You can tell them to do a blood test. I think they're much more open to doing a blood test than doing a digital rectal exam. So that's one way of encouraging young men to do it.
But we
But I think the fact,
but without cutting you, but most doctors now, particularly urologists, are saying that both procedures or screening should be done simultaneously. So maybe we telling them, well, the blood test is not the right thing. You might need to really explain to them now why the digital rectal examination is so important and how it differentiates from that of the blood tests.
sure, and we have been doing that when we're doing this current campaign now. We have been doing that.
Awesome.
We have been letting them know, and there are men. I've seen guys in Marigot that they're waiting stuff who were in their early 40s, late 30s, and they came and had questions. So we do inform them that you need to do this DRE in order to really find out what's going on.
Awesome.
But if you're scared of it for now, at least do the PSA. And if the PSA is rising, then we encourage you to go get the DRE done if you're still scared of it. But as I said, men are getting less scared of the DRE now than long ago.
That's good.
Good. But doctor,
And the women are encouraging them.
Which is good.
right? Because I was just going to say that too. That we one of the things that I remembered at a forum I was talking about prostate cancer, and one participant stood up and said that lots of the women laugh men, oh, you went to the doctor and they do XYZ to you and whatever, and we've discouraged women from doing that because it is not a laughing matter. It is something that can actually prevent a premature death. And we want you to encourage your husband, your son, your men to do the test. It is not something to jeer at and to make it seem almost demoralizing. And so we want to encourage women, when you do talk to your partners about prostate health, including that of the screening, to don't make it a laughing matter, but sell it to the point where we need you. You are important. I need you. I'm not ready to let you go. Our daughter or son needs you to walk down the aisle with them when they're getting married or when they're getting graduated, that type of thing. And so so I'm encouraging women again to change the content of the discourse, to change it a little. I'm not sure you were going to say something or ask him.
I just wanted to ask Mr. Henderson, as it related to his diagnosis. Mr. Henderson, you said at 60 you were diagnosed, and I wanted to know what stage, just to kind of reinforce this early detection and the survival opportunity for early detection. What stage of the cancer was it at the diagnosis?
Well, I can't remember what I stage, but I do remember that it was such that if well, let's put it this way, I had this surgery, and I was not required to do anything after that.
Okay.
So I did not have to do any chemo or radiation or anything like that. So the only thing the doctor told me was that there was a slight capsular invasion. A little of the cancer might have come out of the prostate. But that was back in 2010, 14 years ago.
Right.
And I still do my PSAs. And it was, after the surgery, it was 0.01 something. Right now, I did one earlier this month, and it was 0.03. So I've seen this slight increase, which is not significant. But I keep monitoring it and giving the results to my doctor. And we say, if we get a rapid increase, then we'll look at other treatment. But right now, there's no prostate. Maybe there's cancer cells are in the body, but there are a few of them still around, hanging around. And we'll just keep monitoring. So in my case, I'm assuming that I caught it early enough.
Yeah.
So it did not cause much damage.
Seems so.
Well, Mr. Henderson, we want to really thank you for joining us today on Health Vibes and sharing your story. I think it was quite informative, and continue being a huge advocate not just for prostate health, but also for cancers and men's health. I think you've been playing a very vital role in the information that you disseminate throughout the island. Thanks again and have a good morning.
Yes.
Thank
And-
you, and
and-
thanks for the job you guys are doing also.
Thank you.
Appreciate it. Too.
Thank you for being so candid. I appreciate the candid nature of that interview.
Yeah.
Thank you so much.
But
No problem at all.
yes, thank you. Dr. Johnson, before we close, because we have very little time, I just want to talk a little quickly on how expensive some of the treatments are, the medications. So a lot of the times, we might be careless and we might just assume, oh, well, I must die, something must take me out, and we have that kind of cavalier attitude. But sometimes we don't just die, we stay and we linger for sometimes
And
years
suffer.
and suffer. And the family has to put up that bill because according to your stage, you may not be able to work anymore. And I'm telling you that some of these medicines are very costly. There was a gentleman that we were ordering um, treatment for prostate cancer, and that treatment was costing, I think, 14,000 something dollars, and he had to use that. It was an injection. He had to get injected every 4 months. $14,000. And afterwards the person could not sustain. They had to seek help and get people to help them. So we're talking about that. There is, I know of this particular one that we have as well. One injection, $1,500. You understand? So these things, that's why the early screening is important, that you can actually save yourself the premature need to spend all this money. So it's not just about maybe, okay, I can get a pill. It depends on the stage. It depends on the complications as well that this disease may have caused. And so we want you to not to be selfish, but rather to be wise and to be conscientious that the decisions that you make at times can impact your entire family.
Yeah. So you're right. Treatment for cancer could be very costly, okay, or is very costly, and you quote some figures, okay. But and one can undergo what you call financial catastrophe when you have any type of cancer, okay. Particularly the cancer is not caught at an early stage, and particularly cancer is spread. So the treatment for cancer, the different types of treatment that are offered to men who have prostate cancer is a discussion between the man and his family as well, and the doctor, and the options. Okay, and that is dependent a lot in terms of what is the stage the cancer is at. Because treating a cancer that is just localized, a prostate cancer just localized in a small part of the prostate, it's not the same as a cancer, or the cancer that has taken all over the prostate or has invaded other surrounding organs. So you can well imagine the options that are available and the cost will depend on at what stage the cancer is caught. So yes, in fact, the treatment could even start as what we call even watchful waiting or active surveillance, in terms of, okay, the biopsy shows something this year, it's suspicious, the PSA, let's monitor it and see what happens. Then we go down to more real thing in terms of offering, okay, look, probably you might have to do radical prostatectomy, or offering that option, radical prostatectomy. Prostatectomy, that big would basically mean removing the prostate, which is what the survivor spoke about. It could have to do with moving all the prostate or part of the prostate. Then you have things like radiation, okay? And again, it depends on where you are. In Dominica, we don't offer radiation therapy, so it means you have to travel somewhere to get that radiation therapy. There is chemotherapy, which you're referring to in terms of drugs, and the chemotherapy, it's pretty expensive, all right, to get treated for cancers. for prostate cancer. There are other options in terms of prostate cancer treatment, which you call cryotherapy. That is cryo. It's like freezing the cancer cells and trying to kill the cancer cells. There are other options in terms of well, it's not available in Dominica, but it's available within the Caribbean, CARICOM countries, where you could actually implant what you call like pellets and things, internal radiation. Okay, we call brachytherapy. All right, and that is a little bit expensive. I mean, I wish we had a survivor who did it, and we could talk about all like $80,000, to get that treatment done. So the treatment option that is available is a discussion that has to take place with yourself, your doctor. You could also seek second opinion if you're not satisfied with what one doctor, what your disease is telling you, and your family members. But for cancer, it's generally very expensive, and one could go through what you call financial catastrophe. And that is why we advocated early detection. When you detect something early, then you can treat it early before it spread, like in the case of the survivor, Mr. Henderson. Okay. And therefore the cost will not be that great compared to if it is spread. Because if it is spread to other organs, to your bones, to your bladder, to your kidney, your colon, all right, it's a different matter altogether. Okay. Good.
All right. So it's now 11:39. We've taken some of QFM's time, and so we have to wrap up. It was such a pleasure again being there with you. But Dr. Johnson, closing remarks.
Oh yeah, but the closing remark, I want to close by thanking Jollies. Okay, I also want to thank some great people quickly. I think, and to remind everyone that we have these activities going on. We had our activity in Grand Bay last week. We had, for instance, a community forum, and I want to thank publicly the manager of the Grand Bay Credit Union. She's such a great individual who went all out to ensure that we and the board of directors, I should say, of the Grand Bay Credit Union to have us use the facility of the forum, and to the health team for doing the screening, but also to the lab. So we advocated. Yes. We must say that. I know we're ending. But I want to thank the lab who have joined the Dominica Cancer Society and are offering a percentage discount on PSA and some tests for prostate cancer. Okay, I think most of the labs in Dominica are on board, and even some of the pharmacies, or most of the pharmacists, we have also asked them to give a reduction in terms of some of the medication that men usually buy related to prostate cancer. Okay, I think it's an awesome response. It's an awesome gesture. And finally, I want to end by encouraging the private doctors as well who are offering free screening. I mean, I do private work, private physician. I'm at Hallsborough. And we're also offering at Hallsborough on the days that I'm there, on Monday, Wednesday, and Friday. Free screening for men for prostate cancer, free digital rectal exam screening for men, and also when I'm at Margaret. And to thank also the other private physicians who are coming on board. And for me in particular, if you want to get screened and you want to make an appointment, the number is 225-3950. That is 225-3950. Whether you want to get screened at, I'm checked at Hallsborough Medical in Roseau, Center of Roseau, or at the Village Pharmacy in Margaret, where I am on a Thursday. Okay, so thank you very much. I think time goes quickly when you're having fun with Mr. Landa and
Dr. Johnson. Next week we will be having this big session at the University of the West.
We're having this panel discussion. I think you'll be
moderating.
You'll be moderating it. Yes. I can imagine.
Yeah. Right. So we really want to encourage all men in the area, the Roseau catchment area, the South. Once you have your vehicle, to join us at the University of the West Indies auditorium. Yeah. That is next week Thursday.
Wednesday.
Next week Wednesday from 7. Yeah. I don't have all the information with me right now, but I think it's from 7.
More information.
Yes, but we'll give you more information next week. But again, from all of us here at the studios of QFM, as always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and continue to enjoy the rest of your day.
Introducing Jolly's Pharmacy, brand new website, www.jollies.com.